let's do our chapter 8. This one is kind of a weird chapter. There's going to be a chapter on muscles that's similar to this, where I'm going to just walk you through things that you essentially got to memorize. But this one matches with lecture. And to be honest, I've always felt really weird about teaching this in lecture. To me, this is lab stuff. So because it's really anatomy, and to me the lecture should be the physiology. But anyways, this always happens in every A&P course, and I always feel weird teaching it because I'm just pointing to things that you really would learn better by picking up bones. Or looking at muscles when it comes to that particular chapter, which I think is 11, which will be like this, but with muscles. So in chapter 7, we went over the physiology of bone, right? So here what we're going to do is look at the skeleton itself, all right? And like I said, this is really anatomy, all right? So there's going to be a lot of slides where it just has pictures of bones, but like I said, it's better to actually, pick up a bone in lab and do this. So here are your learning outcomes, and I'm just going to walk you through these. And again, use the study guide. All right, so the skeleton. So first of all, you have to be able to differentiate whether a bone is in the axial or the appendicular skeleton, all right? So when we're talking about the axial, so that's what's highlighted in green here. So basically it's the axis, all right? So you're talking about your spinal vertebrae, everything involving the skull, including the ear ossicles, the hyoid bone, which I will show you that the hyoid doesn't articulate with any other bone. And when I say articulate, that means to form a joint with. So an articulation is a joint, all right? So this is axial, right? So you should be given a bone, you should be able to say whether it's in the axial or the appendicular skeleton, which is the rest, which is now in purple here. All right, so this is basically the appendicular skeleton are the pectoral and the pelvic girdles, as well as every bone of the appendages. All right, so that's basically what you're looking at here. All right, now I'm going to reinforce the different shapes of bones. All right, we talked about this already in the previous chapter. I have highlighted here the sesamoid bones as well, that I'm going to show you this as well. But the one thing we didn't really talk about in chapter 7 were the sutural bones. I mentioned that those bones are not named and that sometimes these occur, all right? And these will vary between people, all right? So in chapter 7, we did irregular bones, short bones, sesamoid bones, long bones, and flat bones. But we didn't really highlight these sutural bones. So these are like bones that appear in the sutures, which are these joints between the cranial bones, which I'm going to go over shortly, all right? And like I said, these are not numbered or named because they're different in different people, all right? And then when it comes to the sesamoid bones, I mentioned this before in chapter 7, that the only one that's named is the patella, because that's the one that's common to everyone. But as you can see here, you can have sesamoid bones in your hands and in your feet. So this is in the feet, but you can also get them in your hands. So here, they'll show up in places where there's a lot of pressure, right? So they'll show up there. So you can see that in this person's foot, they've got 2 sesamoid bones at the great toe. Well, here's the toe, but within the foot. So this would be in the in that part of the foot where your great toe or your hallux is pushing down on the ground. All right, and this can also happen in the hands too. You can have sesamoid bones there, but again, they're going to be different in different people, and so they're not named. All right, so when it comes to these bones, all right, so if you look at, the skeleton, I'll go back here. So there's 206 named bones. And at birth, you actually have 270, right? So there's a lot of the bones are going to fuse with age. So you actually can go down, but an adult has 206 formed bones. named bones. So you have 80 axial and 126 appendicular. Yeah, all right, so the next thing, oh yeah, here, this is what I was saying. Because one of your learning outcomes is understanding how why the number of bones vary with age and with development. So there's 206 bones in the typical adult skeleton, and this is going to vary with development of sesamoid bones as well as sutural bones. So the sutural bones are also called wormian bones. I think it should have a capital on it, but I apologize if it was supposed to. And then there's some bones that form within tendons, like the patella, all right? So there's extra bones, like I said, these sutural bones within the suture lines. And like I said, at birth, you can have 270 bones, and then those are gonna decrease as those bones fuse, all right? Now the bone markings, all right, so this table 7.2 is not from the Saladin text, it's from another textbook that I used to use. And I had to add a few because you've got a certain number in your learning outcomes. It says to refer to table 8.2, which is in the Saladin text. Now, I have not required everyone to have the Saladin text. So I went to table 8.2 and I added these ones because these appear in table 8.2, but they do not appear on my slide. So this slide and this slide, these two slides, have all of the bone markings that are listed in table 8.2. So if you're worried, don't worry because I've got them all listed. And there's a couple extras because this chart had a couple of extra ones that weren't in that table in the Saladin text. All right, I think there's like 2 extra here. All right. I just like this slide because it's nice and clear, and sometimes making slides it's not. So I just added this myself. All right. So this is not something that I'm going to go through. This is just learning it, and it's confusing. And to be honest, this is when it comes to bones. This is what I'm worst at, are the namings of bone markings. I know what these terms mean, but when I try and look at a bone and decide whether something is a process or protuberance, I'm not an expert on that, all right? So what should you do? Well, learn the terms, be familiar with what they mean. And in terms of finding examples, well, just look at the bones that I have highlighted here in this talk, and you should learn those ones. In lab, there's a certain learning outcomes, and they tell you exactly which bone markings on which bones you need to learn, all right? But if you can learn these different, like what these terms mean, it will help you a lot when you look for something like that on a bone. But a lot of them are very similar, right? So this is where it comes experience, right? So people who are physiologists or anatomists, and they can be really good at this, right? But I am not one of those people. Because, like, for example, alveolus or fovea. It says a pit or a socket versus a small pit. All right, I myself don't have that level of experience to know which one is a fovea or an alveolus. I have a feeling that if you become an expert in bones, so if you end up working with an orthopedic person or an orthopedic surgeon, for example, you specialize in bones, you're going to learn these different examples of these things, and you would just know what they are because you'll just know them because you're going to just learn them because it's part of your job. All right. So I absolutely don't expect you to be able to tell the difference between a fovea or an alveolus. All right. Or if you look here, a canal, a tubular passage or tunnel in a bone versus a meatus, a tube-like opening. All right, so whatever, right? So, but if you could learn what the terms mean, this is where flashcards are useful. You could do that, all right? But again, which ones do I expect you to know? Refer to the study guide, all right? So this table and this table will list all of the ones that you need to know. Here as well, I think the learning outcome says the spine, and this table calls it the spinous process. This is the same thing, all right? And then here are some examples, all right? Now, in terms of cranial versus facial bones, all right, so I think that sounds logical, all right? So the cranial bones are the ones that are going to be housing the brain, right? So they're going to form that space in which the brain is situated. And there's 8 of them, all right? Facial bones make up the face. So, you know, one of your learning outcomes is to know the difference between cranial versus facial bones, all right? So the cranial bones are encasing the brain, and then the facial bones make up the face, all right? Some of them do a little bit of double duty, but this is the breakdown, all right? So when you're learning these, and this skull shows the 2 different angles, I should have highlighted this one red. But basically what we have is one frontal bone, which would be your forehead. And then there's 2 parietal bones, which are sort of the top of your head, and it's a paired bone. You can't see it with this picture, but there's one here and one on the other side. There's 2 temporal bones, all right? So here they are in green, all right? And there's going to be one on the other side of the head. You can see them here as well in green, all right? There's one occipital bone, so that's going to be the back and the bottom part of the head. This is the foramen magnum, where the lower spinal cord is going through, where the skull, at the base of the skull, base of the brain. And then there's the sphenoid and the ethmoid, which are weird ones to learn, all right? So the sphenoid is this one here. We call that the cornerstone. It's the one that holds all of these together. And then anterior to that is the ethmoid bone, and you can sort of see it here in the eye socket, all right? And then if you look at it from underneath, here's the sphenoid bone, and here is the, oh, it's not shown. Oh, the vomer. Where's the ethmoid? You can't see the ethmoid from here. You can see it through the eye socket. You can see it over here. You can't. Actually, here it is. No. Actually, no, it's not. You can't see it from the bottom. You can only see it here from the side, all right? But you can see it once you open up the brain case, all right? All right. It's just weird that they have it the same color. I wonder why they would do that, just to confuse you. Anyways, look at it as right here. Ethmoid bone, right here. And here they call it, you know, it's right. I don't know why they have the same color. That's just there to really confuse you. But here, look at it from here. Okay. Now, here's another view. All right, so here you can see the frontal bone a little bit better. You're going to see the same slide later for the facial bones. See here, you can see the ethmoid again, right? You can see little bits of it here in green. This is why I want to show you this here. All right, so you can see it from here, but like I said here, you can't see it from the base. I'm used to seeing this open. The skulls that we have in lab, you can open this up and then you can see it, but you can't see it when the skull is together. Okay. So here you can see this frontal bone, and then you can sort of see that we have the 2 temporal bones, one on each side, all right? And the same thing with the parietal bone, all right? Okay, now, so here again, these parietal bones, here you can see them from the top, all right? Now, what you're gonna start to see are these names of these sutures here. So the sutures are joints between the cranial bones, all right? So you have the coronal suture, you've got the sagittal suture, which is between the 2 parietal bones. You can see the lambdoid suture, which is between the parietal bone and the occipital bones. And have they named this suture on here? Oh yeah, here it is, squamous suture, right here, between the temporal bone, the parietal bone, and the occipital bone. So you can sort of see it here, all right? So sutures are the joints between these cranial bones, all right? So you need to learn your sutures as well, all right? So if you look on page 2, I have comparing cranial versus facial bones. So cranial, you've got 8 bones, and facial, you've got 14, all right? And then I listed underneath cranial that you can see the sutures between these different cranial bones, like I highlighted there, all right? So here, sagittal suture, lambdoid suture, coronal suture, and here's your squamous suture, all right? So you need to learn those sutures. And the Wormian bones or the sutural bones will appear inside of these sutures, all right? So, and they will be different for different people. But when you're looking at the models in lab, they don't have any of those sutural bones, all right? And like I said, they're also called Wormian bones. Now, the temporal bone, there's a couple of things that I want to sort of highlight here because they kind of are sort of weird things that you'll see. You can see there's this thing called the styloid process. Please don't call it the stylus process or the styling process. It's styloid. All right, it's sticking out here from the temporal bone. You can sort of see it here. Another interesting thing is this mastoid process that you'll hear about, and the zygomatic process. These are things that you should be able to identify on the skull. And then the reason that it's helpful to learn these is because there's going to be muscles that are attached to these. All right, so so there's a few. Like, you don't need to learn everything. I mean, within reason, but I'm just sort of highlighting these ones because they will come up again. All right. If you look here in the temporal bone, you can see this meatus. So this is where the ear canal is going to go in. All right, so you can sort of see this is the medial surface. So on the inside of the bone, you can see the hole here. All right. Okay. Now, inferior view of the skull. Things to highlight here. The foramen magnum, it's really weird. In lab, I almost always use this because if a student doesn't name this, I know they didn't study. This is, like I said, this is the big hole at the base of the skull, all right? And here you can see some of your facial bones. Here you can see the vomer here, which we're going to get to. Here you can see the sphenoid. Remember, you can't see the ethmoid bone from underneath, all right? And then here you can see these other facial bones that you'll see the palatine bone. Then here is the maxilla. There's 2 bones to that, all right? You can see them all listed on page 2. So you've got 2 of these maxilla. You've got 2 palatine bones. You can see that there's a suture in between here. You don't need to learn this suture, all right? So this is intermaxillary suture. You don't need to learn that one. But you notice that there's these 2 bones. Then if you look, the vomer is just 1 bone and it's right in the middle, all right? Then I don't know if you can see this zygomatic. Oh yeah, here, zygomatic, because I know you can see it from the side. So you can see it here, the zygomatic bone. And then the lacrimal bones you won't be able to see because that's where your lacrimal glands are, which are your tear ducts. You're going to have to see that from the previous one. You should probably be able to see it here, lacrimal bone. And it's right here where your tear ducts are, all right? Then there's the inferior nasal conchae. When we're learning the bone, you'll learn that there's 3 conchae. There's superior, medial, and inferior. And the superior and the medial are actually part of the ethmoid bone, which I'm going to show you. But the inferior nasal conchae is its own bone. So here you can see middle, and here's the inferior. So here you can see it here. This is a paired bone. It has its own bone, all right? Whereas the middle nasal conchae is part of the ethmoid bone, all right? As is the superior, which I don't think is on this particular slide. Okay. Then the nasal bone, there's 2 of those right here. That's right, that one should be easy. That's your nose, and you can see that there's a suture in the middle of that too that's not labeled. And then of course the mandible. The mandible is a single bone, right? The maxilla is 2. We looked at the maxilla from underneath before. The mandible was missing. A particular bone marking that's very common in lab that we talk about is this one here, this mental foramen or foramen. It's pretty distinctive, so that's often used. Notice here you can see the vomer from the front as well, that single bone down the middle. And then again, here's your ethmoid bone, all right? All right, so let's keep going here. Okay, so a little special stuff about the ethmoid bone and the sphenoid bone. So the sphenoid bone is a really wild bone, and And you can see it from many angles in the skull. And the reason it's so important, we call it sort of the keystone, right? So it holds a lot together. And there's these two wings. So there's the lesser and the greater wings, okay? You can see it in the orbital fissure, all right? And there's different nerves that are going to pass through that. This one, I don't even really know where that is on the bone, but I found this really interesting because it's housing the pituitary gland. So when we do brain, the pituitary gland is hanging down from the brain, and it looks like it's very exposed. And the reason I wanted to highlight this, I haven't seen a picture of the sphenoid bone where this is labeled, oddly enough. But the reason I wanted to bring it up here is because the pituitary gland is sitting in there. And that's, I guess, would protect it, right? So this I found really cool. This is something, actually, like I said, I always learn something new. So this was new to me with this textbook, the Saladin textbook. I've never seen this in any of the textbooks that I've used for A&P. And as you know, I'm a chemist, so I've spent a lot of time learning A&P over the past 10 years that I've been teaching it. And this was a new one to me, so I wanted to share that with you, all right? And I thought, oh, wow. So that pituitary gland isn't exposed. It's actually sitting in a bonus structure, of course, the sphenoid bone, which is the key bone for the entire skull, all right? Holding everything together. And that's why when you look back here, you can always see the sphenoid bone in some way, no matter what view we're looking at, all right? Now, the ethmoid bone is anterior to the sphenoid bone. So it's between the eyes and towards the nose, all right? And it has, when you look at the brains, it's this cribriform plate, and there's a whole bunch of holes in there. And that's where a lot of the neurons and the nerves from the nose go directly to the brain. So when they say that they want to give like a nasal spray for different vaccines through the nose, that's how it gets to the brain, through the cribriform plate of the ethmoid bone. And like I said, the superior and middle nasal conchae are part of the ethmoid bone, whereas the inferior is its own bone, all right? So here you can see them labeled, all right? So here's the superior and the middle, all right? Okay, all right, let's keep going here. All right, so here you can see the ethmoid bone again, and here you can sort of see where it's sitting in the, just in between, like just at the, at the base of the nose, all right, or at the back of the nose, right? So that's where your conchae are going to be important. So the conchae, there's a mucous membrane that coats this. When we do nose, you'll learn about this. And it's covered with, like I said, a mucous membrane. So it's got the goblet cells in it. And these conchae are to moisten and warm the air that you're inhaling, all right? And here you can see your cribriform plate, all right? Okay, so like I said, the sphenoid bone we call the keystone, right? The keystone bone, or the key bone. Just like in a Roman arch, right? The top bone in the arch, it holds everything together. If you remove that, the whole arch comes apart. The same thing is the sphenoid bone. It has this role to play in the skull, all right? Now, some of these fossa or grooves within the skull. All right, so here, and they house the brain. So when we're looking at the brain later on in the semester, and when you're looking at the brain later on in the semester, you'll look at the cerebellum, and you'll see the temporal lobe and the frontal lobe, and they're sitting in these sort of grooves or fossa in the skull, and they are being housed by these cranial bones. All right, so this would be something to imagine. So when you're looking at the skulls in lab, you can see these sort of grooves or bowls where these parts of the brain are going to be sitting in. All right. All right. Now going back to the sutures, right? So here is a better view of the sutures. All right. So here's your sagittal suture, coronal, your squamous, and your lambdoid. So these are the ones that we want you to learn. Okay. So your frontal bone, occipital bone, parietal bone, temporal bone, all right? Now, the next slide is highlighting what these sutures are in the infant. So in the infant, you know, the head is squishy, right? So it can fit through the birth canal. And at that point, these sutures are, you know, open fibrous membrane, okay, mesenchymal filled spaces between these cranial bones, and they're, you know, and they move around, right? And that's why sometimes baby's head has got a funny shape, and they're called fontanels. I notice, like, most of the time I see fontanels spelled like this with N-E-L-S, but I noticed that the Saladin text spells it like this. So I'm kind of like, I think that's kind of weird. This is the first time I've seen it like that. And you can see even on my figure here, it's spelled like that, with an E-L instead of an L-L-E at the end. So anyways, I put that there. I guess that's an alternative spelling. So why do babies have these? Well, like I said, to allow for the bones to shift during birth, and also to allow for the growth of the brain, all right? The two frontal bones are going to fuse by the time, because there's, again, remember the infants have more bones than adults. So the two frontal bones are going to fuse by age 6. And by 8 or 9, the skull is going to approach adult size, even though kids are smaller. So that's why sometimes the head looks a little bit bigger on some kids. But your skull and your sutures are not fully closed until you're really an adult, especially the one up here, this anterior fontanel. That's the one that I believe that one closes the last. And that's why we worry about teenagers having brain injuries, because this is not fully formed yet, and the brain isn't fully formed. I know that some of you might be 18, 19, you think you're fully grown, but you're not. You're actually not. Not until you're about 20, 22 are you fully done. All right. Okay. Now sinuses. Oh, here's your 14 facial bones. All right, so I've labeled them on this same slide again. So here's your total. So 2 maxillae, 2 palatine bones, 2 zygomatic, 2 lacrimal, 2 inferior nasal conchae, 2 nasal bones, 1 vomer, 1 mandible. All right, so I went through that already with the other picture. And here you can see it again. This is the same picture. I just went through it before. I forgot actually that I had this picture again, but anyway, so you can see all of these bones again, and you can practice. All right, if you want to, you can sort of try to cover up. You know what would be a good thing to do to practice? You could print this out and then cover up the names, and then see if you can get all of these, including the sutures that are pointed out. All right, that would be really good practice. And this one as well, right? So I would do that to study. You need to know it for lab as well. So that would be a good way to do it, all right? And then again, the inferior view of the skull, where you can see all of these different bones again, except of course the ethmoid. Now, the sinuses, all right? So I was talking about the conchae. We have several sinuses, and you can sort of tell which sinuses they are by the name of them or where they're situated. So the maxillary sinus is going to be in the maxilla. The ethmoid sinus is within the ethmoid bone. The frontal sinus is within the frontal bone. So you can see in the sinuses, these are basically cavities lined with mucous membranes, and they're producing mucus. All right. Yeah, I'm just looking what I have in my notes. Great. So they're going to warm and moisten the inhaled air, as I had mentioned already. Okay. Here's another view of where they are. It used to be in lab that you'd have to be able to identify all of these, but I don't think we're making you do that anymore, but it's part of your learning outcomes for lecture. So you can see more of these. You can see in the frontal sinus, you can see that there's 2, like this paired, and the maxillary sinus is also paired. The sphenoid sinus is just one single one. And then you can see these ethmoid ones. There's several different ones. There's about 6 different spaces in there. And this is what's producing all your mucus, all right, in your sinuses. And when you have a cold, these get swollen. The hyoid bone, this is a really weird one. And as I mentioned already, it does not articulate with any other bone. It is basically being supported by connective tissue. You can see that there is the stylohyoid muscle, so the hyoid styloid process and the hyoid bone here. And you can see the different features on the hyoid bone. We usually don't get you to memorize these, but just so you know, this is, if someone is strangled, this bone is very often broken. So if you're in criminal justice, that would be something to look at. I think there's a couple of people in criminal justice in this course. So this bone, like I said, would be broken if someone was strangled. Now, the next is the vertebral column. So we're still in the axial skeleton. So here we've got the vertebral column, and there's 7 cervical vertebrae. So they're at the top, all right? There's 7 of those. And then there's 12 thoracic vertebrae, all right? And then there's 5 lumbar, all right? Now, the easy way to remember this is that 7 plus 5 is 12. So that's how I always remember it. I know that I always know that there's 12 thoracic vertebrae. I don't know how I know that, but then because of the 7 plus 5, I know there's 7 cervical and 5 lumbar. That will sort of help you. And they're, you know, labeled by their capital letter. So L being lumbar, T being thoracic, and then C being cervical. Okay. Then the sacrum and the coccyx. All right, sacrum and the coccyx. These are fused bones. All right. So these are single bones that result from the fusion of several vertebrae. And if you look at my notes, you can see how many. So the sacrum is 5 fused bones, and the coccyx is 3 or 4 fused bones. It will depend on the person, all right? But then in the adult, we say it's 1 bone, all right? Then there's different, and the vertebrae are ones that we use a lot in lab for the different features, all right? So this is a representative vertebrae. I'm going to show you a chart that compares them, because you're supposed to, in lab, be able to tell the difference between cervical, thoracic, and lumbar vertebrae, all right? But some general features, and I kind of drew a sketch on page 3 of my notes as well, all right? So here's the vertebral foramen, and this is where the spinal cord is going to be going down here, okay? Then we have the pedicle, which I always think is like a pedestal. It's holding these processes up. So you've got 2 transverse processes and 1 spinous process. This is the one you feel when you rub down your spine with your hand. You feel the spinous processes. Now, this lamina is connecting these different processes. So the 2 transverse and the spinous, so that's the lamina. And these together make the vertebral arch, okay? And then this thing here is the body, so that should be pretty easy to remember, all right? Now, these are going to be different facets, but they're going to vary depending on which vertebrae you're talking about, okay? So the facets are where you're going to have joints, either with other vertebrae, or depending on which type, you might have it articulating with ribs as well, all right? You're going to have different facets, all right? Okay, now the cervical vertebrae, there's a couple of things that are, and we use these a lot in lab, which is why I bring these up. So some special things about the cervical vertebrae that you'll find. Here you've got these transverse foramens. These are only going to be apparent in the cervical vertebrae. And then the spinous process is what we call bifid. There's always like a split in the middle. That's the other thing that you're going to see in the cervical vertebrae. And the body is really small. It's very, very small compared to other ones. But the vertebral foramen is really big, all right? So this, because the spinal cord is like by the brainstem here, and it's a very big kind of space at this point. Then the atlas and the axis are two very special cervical vertebrae, and you can see them here. So atlas is C1. This is the one that's supporting the head. There's no body for this, supporting the skull, I should say. There's no body in the atlas. And there's one really big round of vertebral foramen here. And here you can see these facets here that are going to support the skull. And then C2 is also very special. It has a couple of features that you won't see anywhere else. And the main one is this dens. The dens is going to articulate with the atlas and allows the head to turn. And I have a slide where you can see that. So this is a really important kind of feature that you'll know is going to be C2 or the axis. So atlas, if you know, I think it's Greek or is it Roman? I don't know. But that's the god that holds the earth. So you could say holding the skull. So that's C1. And the axis is going to have this dens to allow the skull to turn on its axis. All right. So how does that look? So here you can see the articulation between the atlas and then here's the axis. And here you can see this dens sticking up, and there's a transverse ligament that's going to join two different parts of the atlas, and it's going to wrap around the dens to allow the head to rotate. Okay. And then later on in life, these actually fuse and make one big bone. All right. Okay. Now, so here are the basic things to look for. All right. So something that you don't see from this view of the thoracic vertebrae is that the spinous process is really long and it points inferiorly. You don't see that here on this slide. All right. But when you're in lab, make sure you have a look at that, because that will help you, without a doubt, know when you're dealing with a thoracic vertebra. The other thing with the lumbar vertebrae is that this body is really, really big. Here, what's going to happen with the spinous processes is they're going to point the other direction. They're going to point posterior, not the other direction, but they're going to point outward, so towards the back, and that's why they're really prominent when you feel them with your hand. Okay, so little differences. So these will help. The whole point of this chart is to help you learn the differences between these different vertebrae when you're in lab. All right. Now, articulated vertebrae. So in between each vertebrae is going to be your intervertebral disc. All right. So the intervertebral disc, we always tell you, is fibrocartilage. It allows a little bit of movement. Here you can see how these vertebrae are sort of stacked on each other and how they articulate with each other. And these are lumbar, so you can see that the spinous process is sticking straight out. And that would be sort of your telltale sign here. If it was thoracic, these spinous processes would be pointing downward, all right, or inferiorly. I'm going to catch up on my pages and my notes. Okay. Now, intervertebral discs, you have 23 of them, all right? And what they actually look at like, all right, so we said that there's, you know, they're fibrocartilage, but in the middle, there's this sort of like jelly type of thing, a gelatinous mass in the middle. And if you look at it, so the middle part is called the nucleus pulposus. I'm not good with my Latin. But that's in the middle part. And then the annulus, and annulus always means a ring. So the annulus fibrosus, this is your fibrocartilage that's on the outside. Now the reason this is important is that if this gets compromised a little bit, you can have a slip disc or a herniated disc, right? And the reason it's painful is that this jelly stuff comes out and it pushes on the nerves that are coming out from the spinal cord, and it's really painful. So if you've ever had that, I've had it a couple of times when I'm, being aggressive with my gardening. Sometimes this happens, and it's really, really painful. It was the last time I had one of these. It was so painful I couldn't even pick up the tea tea kettle to make tea, and I make tea 2 or 3 times a day, so it was really bad. Even that was too heavy for me, so it was really, really painful. But this is what happens when you have a herniated disc or a slip disc. All right. Okay. So this fibrocartilage between the intervertebral disc is found between the bodies of each of these vertebrae, and its function is to absorb the vertical shock that is there and still allow for movement of the spine. All right. And this one, I can tell you, are thoracic vertebrae, because here your spinous process is pointing downwards. Notice that. So thoracic vertebrae, spinous process pointing downwards or inferiorly. Let's go back, and here these are lumbar. The spinous process is pointing posteriorly or towards your back. All right, so hopefully you can see the difference. Anyhow, now the spine has some normal curves. Here you can see on the right-hand side the normal curves that you have, and they're named. So the cervical curve, thoracic curve, lumbar curve, and sacral curve. These are normal, but they change throughout life. All right, so until adulthood. So the fetal curve, and there's a really nice picture in the Saladin text. I should have put it here in my PowerPoint, but it's of a newborn infant, and you can see how the spine is doing this, and it's really quite amazing. So the fetal and then the newborn has a little bit of a curve, but this curve through the fetus and then towards the newborn, you can see that this is sort of highlighted here in the infant. Okay, so fetal around 6 months, and then newborn. Then as the child gets older, eventually we'll come to the adult curves, and you can sort of see how it changes. All right. And again, and we talked about this already in chapter 7, but the abnormal curves that we can have. So scoliosis, kyphosis, and lordosis. So you can go back and review that. I like this slide. This is actually the Saladin text. You can see the green is what's normal, and you can see how the variations have taken place. All right. So you notice that they show an older person for the kyphosis, because very often osteoporosis does this, but other reasons could be as well. And then the lordosis is very often associated with pregnancy. And then here, notice in the Saladin text, this picture's from the Saladin text, it says this hyper with this, whereas my other textbook would just say kyphosis or lordosis. So just to be careful, they're the same thing, all right? Now, the thoracic cage and the pectoral girdle. So the thoracic cage is part of the axial skeleton. The pectoral girdle is not, but you'll often see the pectoral girdle along with the thoracic cage. So we're going to talk about the thoracic cage first, all right? So what is it for? Obviously, protection of your organs. It's going to help breathing. And with this, you have the thoracic vertebrae plus your ribs and your sternum and your costal cartilages, all right? Now, if you look at ribs 1 through 7, all right, so these we call true ribs. They have a costal cartilage that connects individually to the sternum for each one. And then we have 5 pairs of false ribs. And so 8, 9, and 10, you can see 8, 9, and 10, they have a common costal cartilage, which will come and fuse to the sternum. And then ribs 11 and 12, we say are floating. They're not connected to the sternum at all. So they're out here, all right? So here you can see each of the 12 pairs of the thoracic vertebra are going to articulate with a rib of the thoracic cage. So these are your 12. And then you can see the articulation surfaces, which are out here. So this is another way you can tell a thoracic vertebrae, because they're the only ones that will have these facets. And I don't like to highlight these because some of a lot of the vertebral bones in lab are plastic, and it's really hard to see these. In the picture, they're really obvious because they're colorized, so you can sort of see them. But with those plastic vertebrae in lab, you can't really see it, all right? but you will see the spinous process pointing downwards, so that you will see, all right? Okay. Now, the sternum has 3 parts, all right? So the top part is called the manubrium, and there's clavicular notches. The clavicle of the pectoral girdle is going to articulate here. And then there is the body, which is easy to remember, so that's the long part. And the last part, the most inferior, is the xiphoid process, or the xiphoid. And sometimes the body is called the gladiolus. I don't know why, but sometimes it is. Reminds me of the flower. Now, the anatomy of the ribs. So generally we get you to remember the head and the neck, the shaft, all right? This part here, this flat part, is gonna articulate with the sternum. And then here we're articulating with the vertebrae, all right? So you can sort of see where these little articulation surfaces are. And then in between just next to the head is the neck as well. Just trying to think, obviously this would be angle. This is where it's turning. Trying to think of anything else to try and remember here. All right, again, it feels weird doing this for a lecture, but just to help you learn these things. So here you can see, I put this here so you can see where so here's the neck, and here's the articulation with the transverse process, and then the head is articulating with the facet that's on next to the body of the rib, of the vertebra, right? So the head is articulating with the body, and this tubercle here is going to be articulating with the transverse process of the vertebra, all right? And then in between we have the neck, all right? So then you're gonna have your shaft, and the other part is gonna be articulating with the sternum, all right? So here you can see here, via the costal cartilage, right? So here's the costal cartilage, and it's gonna articulate with the sternum. And here again, you can see these different, the floating ribs and the true ribs versus false ribs, all right? Now, the pectoral girdle, there's 2 bones in each side, and it's made up of the clavicle and the scapula, all right? So here you can sort of see, you're gonna learn these muscles, so this is gonna be useful later, but you can see how the scapula is the attachment point for a lot of muscles as well, all right? So here you can see all of the different, I'm gonna show you another slide of this, but the pectoral girdle, there's 2 of them, 2 on each side to make the full girdle. So you've got the 2 clavicles and the 2 scapulas together make the full pectoral girdle. And the function of that girdle is to hold the upper limbs, all right? So now we're talking about the girdles, we're talking about the appendicular skeleton. So the clavicle is going to articulate with the sternum and laterally with the scapula, all right? So you've got 2 joints, the sternoclavicular joint and the acromioclavicular joint. And then the scapula is going to articulate with the clavicle and the humerus. And then you've got this glenal humeral joint, which is your shoulder joint, all right? So that's right here, glenal humeral joint, all right? Here you can see some features of the scapula that you should try to learn. I've listed them in my notes on page 5. So the spine, the acromion process, the coracoid process, and the glenoid cavity. So try to at least learn those 4. You can see the spine, that would probably be another one to learn. That's the part you feel when you rub it on your back, all right? Like I said, this is the attachment point for so many different muscles, all right? Then with the clavicle, it's a little bit simpler. You've got your sternal end and your acromial end. And then there's this coracoid tubercle that's going to be an attachment point for muscle. I don't know what else to say about it. Don't look in my notes. Is there anything else there? Nope. Now the upper limb, so the brachium is made up of the humerus, all right, and it is going to articulate with the pectoral girdle, and that's going to extend from the shoulder down to the elbow. Then there's the antebrachium, which is the forearm. That's made up of the ulna and the radius, and then of course the hand. So here you've got your 8 carpal bones, 5 metacarpals, and 14 phalanges, so your finger bones. All right, so let's break that down a little bit. So the humerus, you know, major things to know, definitely know the head. There's this lesser tubercle here, the shaft, you know, the lateral and the medial epicondyle would be good to learn. And then you've got your capitulum and your trochlea. Here's the olecranon process, where the elbow, the olecranon process is going to fit in. I'll show you that next when we do forearm, all right? So these would be the things to try and learn about this one. So here you can see your greater tubercle in your head. This is from this view, you can sort of see it here. And then your olecranon fossa, and your medial and your lateral epicondyles. And then your capitulum and your trochlea. So there's a lot to learn on the humerus, all right? Now here you can sort of see the elbow. So here's your ulna, and here's the here's the elbow that you're feeling. So here I said it goes in here. So it's the olecranon fossa. This is the olecranon process that's sort of sticking out here, and it goes into that fossa. And that's what you feel like when you hurt your elbow, and you bump your funny bone. Well, that's what you're bumping. A lot of people think it's your humerus that you're bumping, but it's not. It's this process here if you really hit the tip of your elbow. So here's a capitulum in your trochlea, and this is why it's good to learn, because the capitulum is going to articulate with the head of the radius, and the trochlea is going to articulate with the ulna at the olecranon process. All right. And then here's your medial epicondyle, which is sticking out here, which sometimes you hit. So you can hit your humerus. That hurts too. So anything around the elbow that you hit is painful. Okay, so now let's look at your forearm, or the antebrachial region. So this is made up of the radius and the ulna, as I said. And here you can see sort of different, so here's your olecranon process, which is making that elbow. And then the radio-ulnar joint, that's where the radius and the ulna interact with each other. All right, so and if you look at this, so the radial notch is where the radius interacts with the ulna, and the ulnar notch, all right, is where the ulna interacts with the radius. All right, so that's these different parts, and these are joints, all right, between the radius and the ulna. Here's the radial tuberosity. There's some bones that are joined to that, but I would focus on these arrows. So if you could learn these particular names, that will help you a lot. Yeah, now the next thing to learn is that when you turn your hands, right, when you pronate and supinate your hand. So if you're looking at, you know, in prone position, right, so your palms forward, all right, and that's called, you know, and when you move from the prone, so if you pronate, so if you move your hand so that you're in your prone position, now all of a sudden you're no longer in your prone position because you can see the top of your hand. That means you've pronated, and you can see what happens. The radius is going to cross over the ulna, okay? And then when you go back and you supinate, so that means you turn your hand out again, you can see it goes back where it's all aligned and it's not crossed over, all right? This video here, if you can copy and paste this, or you can go to the video, you can see, actually maybe I'll just do that. I can do that. So if you watch this video, you can see how,
Oops. We look at
hang on a minute, that's not what we wanted. Here it is, this is what we want. I skipped forward. So here you can see the rotation of how this works, and that's what I wanted you to have a visual of, all right? Okay, so let's stop that. Okay, let's go back to my presentation. And then in your hands, you've got 8 carpal bones, and you've got the metacarpals and the phalanges, all right? So the 8 carpal bones, that's what's highlighted here, all right? And they're in 2 rows. So there's 4 bones and 4 bones. And you can see that they're really hard to remember. And if you look in my notes on page 6, you can see a mnemonic, all right? So it says, stop letting those people touch the cadaver's hand. And that will help you learn them in order. So going from lateral to medial, so from the outer part of the wrist to the inner part of the wrist. And from proximal to distal. So proximal is the top row. So closer to, this would be here. And then distal, that's further away from the midline, all right? So this should help you learn these. They do want you to learn them in an articulated hand. You're not gonna have to, in lab, you're not gonna get a scaphoid bone and have to know what it looks like. You're just supposed to be able to figure it out from looking at it in an articulated hand, all right? Now, your metacarpals are the bones of your palm. Okay, so that's here, all right? This is your palm. And you've got 5 of those, all right? So metacarpal 5 is proximal to the base of the little finger, all right? And 1 is at the thumb, all right? And these are the names of the features, so the base, the body, and the distal head. So the head is distal over here, and then here's the base articulating with the carpals. And then the phalanges, all right? Your fingers each have 3 phalanges, so proximal, medial, and distal. But the thumb only has 2. The thumb, or the pollex, only has 2, so proximal and distal, there's no medial, all right? So proximal and distal, and here you can see proximal, middle, or medial, and distal, all right? So you've got 14 of those. You don't have 15 because you only have 2 bones on the thumb, all right? So here's another look at them, so you can sort of see how all of these bones are lined up, right? So the proximal row and the distal row, and then using your mnemonics so that you can learn them. Here they're colorized so that you can see them a little bit better. So hopefully that helps. So I find this tough myself, right? But just so you know, that this should help you. So now we're on page 7, the pelvic girdle. So the pelvic girdle is made up of 2 ox coxa, and that would be, here's one, and here's the other one. And each ox coxa is made up of 3 fused bones. So the ilium is the most superior. Then it's the ischium, and then the pubis, all right? And a lot of people think that you sit on your pubis, but you don't. The pubis is actually moving anterior. You actually sit on your ischium, all right? And I wrote in my notes, you're actually sitting on your ischial tuberosity. So if you see a label, it's not on this particular one. This is what I hope you try to remember of the ischium. So the spine, body, and the ramus, and the pubis, the superior ramus, the inferior ramus, and the body. And then the ilium, so the iliac crest, the iliac fossa, and probably the spine is helpful. Now, in my notes on the slide, you can see that there's the greater and then the lesser pelvis. So the greater pelvis is the false one. So that's up here. And you can sort of see the line from the side here. There really isn't any organs there. I mean, I guess you could argue that some of the intestines are here, but the only organs that you really see here are the uterus and the bladder when they're full, all right? Because they'll expand upwards in here. So full meaning when you're pregnant. But really most of the organs are in the lesser, or the true pelvis, which is bounded by the sacrum and going down to the pelvic outlet here. So you can sort of see, this is the ischium here. So this is and then you're going to see down here would be the pubis, all right? Yeah, so here you can see the ramus of the ischium, and that's what you're looking at here, all right? Let me just see what else is on this slide. All right, so, now the acetalbulum, sorry, is the hip socket, It's not a good view here, so you can't really see it as well, but it's in this area here. And actually every little, each of the 3 fused bones are taking part in that. I like to think mostly ilium ischium, but there's a bit of pubis there too, and you'll see it in another view. And then this obturator foramen, that's this big hole here, all right? You can see it here as well, all right? And there's a lot of blood vessels and nerves that go through that, all right? So here you can see it colorized. So here's your acetabulum, and you can sort of see that all 3 bones are sort of taking part in making that. And this is where the head of the femur is going to articulate. Here you can see the sacrum, which isn't part of the os coxae, but you can see the articulation here between the os coxae and the ilium. And I think in my notes I listed that joint. Maybe I didn't. Maybe I didn't. I thought I did. But it would be the iliocoxal joint here. Oh, here it is. Sacroiliac joint. Sometimes it's phrased the other way around, iliosacral. So that's you know, right here. All right. All right. Anything else to say about this? I think we're good here. And I'm looking at my notes. Oh, in my notes, I have drawn out the pubic symphysis, which is a, you can see here, this is that fibrocartilage between the pubis part of the 2 os coxae. So this is a joint here that's got this fibrocartilage, and I did a sort of sketch. So the 2 body of the pubis are in this part, and then there's the superior and the inferior rami. So if we go back here, so here's the superior, all right, and then the inferior rami on either side of that pubic symphysis, all right, that joint there. Now here you can see another view of the pelvic outlets. You'll see in my notes, I kind of talk about that a little bit. And you'll see it as well in the textbook, all right? But you'll see that it's talking about the pelvic outlets. And when I come over here, when we're talking about the differences of the male and female pelvis, we're also talking about this as well. But you can see that there is a pelvic inlet, which is going to be more inferior, and then the pelvic outlet, which is up at the top. So the inlet is where the baby is going to be born through. And it's really kind of weird because the way it's worded, and I think, oh, here's where it is. It's back here. The inlet. So the opening circumcised by the brim of the infant's head must pass through at childbirth. And I found this really confusing. This is how it's worded in the Saladin text. I usually think of this as the outlet, but I think what they mean is that the head has to turn and it has to go through there. And then it's going to go out through the outlet. So I think that's what it means, all right? So it's kind of a weird way of wording it, all right? But clearly you can see that the inlet is more superior to, the outlet is more superior to the inlet, all right? Okay, because this is the superior, sorry, the superior view, and here is the inferior view, all right, of that. And here you can see really well that the pubis is anterior, right? It's moving forward. And so you're not sitting on your pubis. You're sitting on your ischium. And you can see that here, all right? All right. Now, you're supposed to be able to compare and contrast the male and the female pelvis. So the male, if you look on page 8, is heavier and thicker. The female is not as much, but it's wider and shallower, and there's a larger opening, all right? And the reason for that should be obvious, because of women have childbirth and men don't. Other things is that the pubic arch, which is this thing here, is less than 90 degrees in the male, and in the female it's greater than 90 degrees. And the other thing is the shape. So in the male it's sort of like a V shape, and in the female it's sort of like a U shape. All right, so those are the differences between the male and female pelvis. Now the lower limb, as I said, is articulating with the the pelvic girdle. So in the acetabulum is where the head of the femur is going to articulate, all right? Now I'm going to talk about the femur in a sec. So the thigh is the femoral region. The leg proper, or the crural region, is the lower leg, all right? And then the foot, right? So the ankle is the tarsals, right here. You've got your 7 tarsal bones. And then again, you've got, instead of 5 metacarpals, you have 5 metatarsals. Whoops, I think I spelled that wrong. I'll correct that. And 14 phalanges. All right, I'm going to correct that and then re-upload this presentation because I don't like that spelling mistake there. No, actually, it's yeah, it's okay. It just looks weird. All right, so you've got your metatarsals. It just looks really weird, metatarsals. All right, there we go. All right, now, all right, so let's have a closer look at the femur and the patella. So there's actually quite a bit to talk about with the patella. This is your sesamoid bone. Things of note is cartilaginous at birth. It ossifies at ages 3 to 6. Features, you've got your base, which is actually more anterior, which is weird. And then your apex is here with the point. And the heart is like that too. The apex of the heart is pointing posterior and inferior, whereas the base of the heart is more anterior. So it's really based on the shapes because there's a point here. So we say the apex, all right? And then you've got these articular facets where it's going to articulate with the femur. All right, because it sort of sits in this little spot in the femur. Now here you've got your head, and then you've got this greater trochanter. So you should probably know the greater trochanter. I didn't put an arrow with that. I could probably add one and then re-upload this. And then in between there, you've got your neck, and this often breaks. So just so you know, very often this would break. And then there's the body or the shaft. And then you've got your medial and your lateral epicondyles. Just looking at the surfaces that are articulating with the tibia. Okay, so here's your patella, all right? Now here's your tibia, which is going to be in your lower. But in my notes, I wrote down that the femur is going to articulate with the tibia on the medial condyle, all right, and with the fibula on the lateral condyle, all right, because the fibula is here, but it doesn't actually touch that very well. So I'm going to just sort of qualify that, all right. It's on the fibular side of that, all right, because if you really look at it, it's not actually articulating with the femur, all right, the fibula. All right, so if you want to, in my notes, and I'm going to sort of put that for myself as well. This is because these are new notes, all right? So on the fibular side is probably the better way to do it. And you can add that in to that because it's not actually articulating with the femur, all right? So that's kind of misleading, all right? So the femur is only going to articulate with the tibia. And you can see that on the lateral side is where you've also got the fibula, but it's not going to articulate directly with that. And it's also going to do it with the medial condyle. So you can see that. Okay. Now here you can see another look at that. So now now we're going to look at the tibia and the fibula. So now here you can see the tibia. Now this one's easy to do. It's the heaviest bone of the lower leg, all right? And we often say that this is like a T, and you can see that here, all right? And you can see it articulating with the femur. And notice that the patella actually just articulates with the femur, not really with the tibia very much, all right? Now, your medial malleolus would be a structure to know on the tibia. That's the inner bump on your ankle. Now, on the fibula, all right, the head of the fibula is up here articulating with the, with the tibia. I mean, and then down here, the lateral malleolus, this is the lump on the outside of your ankle that you feel, all right? So now I'm just looking at what other things I've listed here. So the tibial tuberosity, that's this thing that's sticking out here. Now, what I want you to notice here, so the medial malleolus, here you can see this is like looking at it from the inside, all right? And there's this notch here where the fibula is going to be articulating with the tibia. So here you can see it here. So this part of the tibia is going to be sort of stuck into this groove here. Yeah. Now, something I kind of skipped over, these interosseous membranes. So notice there's an interosseous membrane between the fibula and the tibia, sorry, the fibula and the tibia. And there's also an interosseous membrane that I kind of skipped over between the radius and the ulna, all right? Now, this is really important because it stabilizes these bones with each other, but it also decreases the weight. Instead of having one big massive bone here, we've got this interosseous membrane that holds these two bones together. And it makes the whole skeleton lighter. Okay, so this is, you know, one of the benefits of having that there, all right? So here, I've mentioned it here. Here's the anterior crest of the tibia. This is the sharp, sort of sharp bone here that you would, that gets scratched easily if you rub your leg on something. And that's because of this crest here. Trying to think of anything else. Now, really importantly, I'm going to highlight this. So here's your medial malleolus, and here are your tarsals, all right? Now, notice that your medial malleolus is going to interact with or articulate with the talus, all right? Now, this is really misleading to a lot of students, okay? Because when you look at the foot, and I'm going to show you this, when you look at the talus bones, I mean, at the not the talus bones, here, let's go here. Here, if you look at the tarsal bones, all right, everyone thinks the calcaneus is the articulating surface, and it's not, all right? The calcaneus is actually inferior to the talus, all right? So here's the talus, and here's the calcaneus. The calcaneus makes the heel, all right? The talus is sitting on top of it, all right? And that is the one that's articulating with the tibia. So if you think of the T's, the talus is articulating with the tibia, okay? And the calcaneus is below that or inferior to that. It's making the heel, all right? Now, the other bone to orient yourself is the navicular bone, which is more anterior if you look at the foot, all right? Because if you're looking at it, it's kind of weird. So notice that these three are colored the same, all right? So these are the ones you just gotta sort of organize yourself with, all right? So here's your hallux. So this is the inner part of your foot or the medial part of your foot, all right? Now, the other three bones, all right? So here's the medial part. You've got three what we call cuneiform bones. So medial, middle, and lateral, all right? And then you've got the cuboid bone, which is going to be on the outer part of your foot, all right? And if you look, I'm sort of getting ahead in my notes here. So now I'm all the way down at the bottom of page 9, all right? And then on the top of page 10, you can see another mnemonic to try to remember this, all right? So it actually, you read it as tiger cubs need milk. Instead of having a K at the end of milk, it's a C, all right? So medial, intermediate, and lateral cuneiforms, all right, make up the MIL of milk, all right? Medial, intermediate, and lateral of the cuneiforms, and then the cuboid is the C, which would normally be the K of milk, all right? And so remember, look at this, right? So here's your tibia. It's articulating with the talus, which is the most superior. Inferior to that is the calcaneus, which makes up the heel. And then you have your navicular, which is connecting you now to the more distal row of these 4 bones here. So you've only got 7 tarsal bones, all right? So hopefully that helps you. Now, metatarsals are the ones that are making up the foot, all right? And again, you have 5 of those. So again, metatarsal 1 is going to be at the big toe or the hallux or the great toe, and 5 is going to be at the base of the little toe. And then of course you've got your phalanges again, all right? So again, you've got 14 phalanges. Your big toe or your hallux or your great toe only has 2, so proximal and distal phalange or phalanx. And your other toes have 3 bones, just like you had in the hand for your phalanges. Now, you also have grooves or curvatures of your foot. You have curvatures of the spine, you also have curvatures of your foot. And if you have lost your curvatures, you have flat feet or fallen arches, which is called pes planus. And here are your curvatures. So you're supposed to know what they are. So your transverse arch, and then you have your medial and your lateral part of your longitudinal arches. All right, so you've got these 3 arches. And you're just supposed to know those. And that if you have fallen arches, that's called pes planus. And this curvature is there to help absorb shock. All right. And I think that's it. And again, I always feel weird going over this because this is just stuff to learn and memorize. But hopefully me going over this has been helpful. Yeah, and I think that's it.